Good morning. Today we'll be talking about acne is a medical concern in honor of the World Skin Health Day. Good morning, Dr. Ayesha. It's a pleasure to have you again with us.
Thank you very much for having me, Kamala.
Now, you're a dermatologist, and as usual, we are looking at the World Skin Health Day. Can you tell us why bother with the World Skin Health Day? Why is it important? And what is it meant to convey?
Okay, so the World Skin Health Day is a day when we focus on the skin. The skin is the largest organ of the body, and it mirrors exactly what's going on in the body, internally, emotionally, and otherwise. Now, recently, the World Health Assembly has now made skin diseases of topmost priority and of global concern. And this is very, very important. Skin diseases have different effects on the body and on the individual. It affects your psyche. It is stigmatizing. There are several diseases that that come across and picture or start off with the skin. It could be internal conditions like diabetes, other conditions, cancers, and things like that. And then you go down to the actual dermatological conditions, which include several inflammatory disorders. Then we go to things like infectious diseases, monkeypox, scabies, Ebola, um, COVID had skin manifestations. So there is almost no disease that doesn't really have a skin manifestation. And as such, it's important that we give it topmost priority. If you don't feel
Yeah.
and look good, you know, people will stigmatize you. We have vitiligo, we have albinism. So we have several conditions which require topmost priority. And that's why we are very happy as dermatologists that it's being given topmost priority.
I am certainly very happy myself. And today we're talking about acne, and it's very interesting acne because acne happens particularly in teenagers. People will say, ah, don't worry, you grow out of it, you grow out of it. But it is something that actually has a huge impact on people, particularly on their self-esteem. So I think it's something that, and also it doesn't just happen in young people because sometimes when older people get it, they don't recognize it because they cannot relate it to teenage acne. And so if you can, let us talk about acne in depth. What is acne? What causes it? Who gets it? When and where? So can you just tell us a bit more about acne and why it should be a medical concern?
Okay. So like you rightly said, it does affect you at different ages, but more commonly, we all know it in the teenage years. But what is acne itself? It's a chronic skin condition that actually occurs, when your hair follicles become clogged, and they can become clogged with oil, which we call sebum, dead skin cells, and bacteria. And it's actually driven by hormonal changes. Apart from hormonal changes, particularly androgens, you can also have, you have a genetic predisposition, stress, medications, and then skincare products. And in this day and age, we'll come to skincare products and TikTok and the social media frenzy that's going on. Too many products are being applied, and that is also giving us a problem. But then I think what is key to take away is that when you have a skin problem, everybody else but the dermatologist is who you go to. So you start off with your
Hmm.
family and friends, aunties, uncles. You're at church, you're at work, and someone wants to volunteer what they should use. Then you go to the pharmacist, go to a community pharmacist, go to a licensed pharmacist. Everybody else will tell you what to use and what to try. And then you go to Instagram. So we have a certain demographic of individuals between 15 and 30, generally. Their source of information is TikTok. It's what TikTok says. And even recently, BBC had a program where they were talking about it. So it's a global thing. It's not just us here. So when I listened to it that day, I was like, oh wow, it's everywhere. So TikTok tells you to use, oh, this is my skincare regime, and they show you before and after pictures, and they're using 10 things, they're using 6 things, they're using, but on average, I think that CNN article said they were using on average, I think it was between 14 to 16 different products on their
Wow.
face.
Wow.
So apart from the fact that it's too much, it's an overload, it's also expensive. I have a lot of moms come to me, and by the time I say, okay, what are you using? Bang, I say this, they say this. They're using several of the things which are good, but the point is there's an overload. and it's too much. And then you can have irritation of the chemicals. And also the sun. Here we're in the tropics, so the sun does have its effect
An
on you.
effect.
So
Mhm.
those are the things that we're facing.
Wow. I mean, that's quite a lot. But going back straight into this acne issue. So you're saying what causes it as a teenager is different from what causes it as an older person? Is that what you're
So they're
saying?
both no, they're both affected by hormones. So, but
But
hormonal changes at puberty when you're having your surge. But later on, you can have female adult onset acne, and you can have acne around, the 40s when there are also hormonal changes going on. But there are other things, like I mentioned, that can come into play. You might have a genetic predisposition. And then you also have, you know, associated inflammation. There's pain when the nodules become quite big. They can look pustular, and then you like to pop them as well. We have Dr. Pimple
mm,
Popper as
mm.
well on Instagram, or is it TikTok? And at the end of the day, the problem that you now have for us with melanin-rich skin is pigmentation. So apart from scarring, which is a problem, you now have pigmentation. So as you treat acne, you're treating acne, but you should be going along and being proactive about treating the hyperpigmentation that is going to occur. And then, of course, when there is scarring, then we move into the treatment for scarring.
Now, when the teenagers have their acne and when the older women have their acne, is it in the same place? And are there degrees of acne? And when must they come to see the dermatologist? Because you're not going to remove Dr. TikTok overnight. So when would you say, look, this is at this point in time, please look for a dermatologist and not a cosmetologist and not going to, a spa, but
Spa.
actually see a medical doctor.
Okay. So first of all, you would normally have blackheads, which are, small clogged pores with the debris that's in there. We have acne divided into mild, moderate, and severe. Mild acne can be treated by over-the-counter things that your mom might have told you, your friends have told you, that's fine. A good wash for your face, some topical agents that you can use. But persistent acne, when it's now involving the whole face, it's getting worse despite your topical treatment. It's getting worse. I think that's when you should come in because for every individual, getting worse can be different, could take longer. Some people could resolve with the topical things that they've used, and then 3, 4 months later or 6 months down the line, it comes up and you should come in. But definitely when you're having severe acne where you have nodulocystic lesions, so they're looking really like big boils, there's a lot of pain because of the inflammation, definitely you should step in. And I think that at the end of the day, it's different for each individual. So if you personally feel that you've taken some treatment, you've done some topical creams, and they're not getting any better, it's affecting you, please see a dermatologist. And then
Oh,
we need to
thank you.
talk about scarring. So scarring in
Yeah.
itself is better prevented. So the earlier you come in to get treatment, the better it is. But of course, when scarring occurs, then you need to see the dermatologist because there are several things that we can use to help the scarring and improve it and make it better.
Okay. I think that's important to note because I think people, as I said, take it lightly. And
Mhm.
what about mothers? Because I'd like you to talk specifically to mothers, because mothers will say, "I know you grow out of it, you grow out of it." And sometimes years pass, and this child feels, what word do I use? They feel so
You
inferior in school. They feel it affects their socialization. So, can you talk to the mothers or grandmothers or whoever is out there that is listening that may have a child with this problem and is not taking it perhaps as seriously as they should?
so, like I said, I think it's the era that we're in. My generation, it would be, oh, try this, use this, it's not getting any better. You would have been told, it's okay, it's not a problem. But in this generation where you have social media, you have the influence of the social media. Everybody's wanting to look good. There's peer pressure. There's always been peer pressure, but the peer pressure is enhanced and intensified by social media. So everything, everybody's looking picture perfect. there's editing, there's cosmetics, there's all sorts going on. So they want to look good. Their self-esteem is eroded. They don't feel confident. People are bullying them and things like that. So it affects their confidence. And that's where I think, as far as for each person, it's different. If you've tried something and it's not working, you want to get better treatment, you want to get your problem solved, then see the expert, see the dermatologist, where we can step in. But we encourage mothers to please let them see the dermatologist. The individuals, the young generation now, they know what they want to do, although they quickly want to do it via Instagram and use all of those products. So there is a bit of, we're trying our best to educate and do what we can, but we're working against a more powerful viral culture, which is, we can't catch up
Yeah.
with.
Well, and also it's about
So
sales. It's about sales. So those people are selling products. So they're very
yes,
aggressive
that's
about
it.
how they push it out there and make it about making money. It's actually all about making money from a lot of these products that are out there and combating that, or changing the person to understand, look, it's all about what is best for you, not just what they're selling to you
Generally,
can be a challenge.
definitely, definitely, that's it.
Thank you. Thank you very much. Thank you, Ife, for coming on the program and sharing your experience with us. We appreciate it. Can you tell us about your journey when you first had acne or pimples and how you ended up getting it sorted out?
Hi, Pamela. Thank you for having me. It's very lovely to be here. Um, my journey started in my late teens. I didn't have acne throughout secondary school. And so it started like in my late teens when I was about 16 and I was in my first year in university, but it was mild. It wasn't serious or severe. And I had first seen a dermatologist, I think when I was 20, because it got more severe then and then it was fine. But it came back some months after and I just gave
Can
up.
you
I
tell
didn't
us
go back
what
to
you
see a
used?
dermatologist again.
Can you tell us where you went? Did you just sit at home and look
Okay.
at it, or did you actually use something? Where did you get your information from? Just tell us your journey.
Okay. So in the beginning, I pretty much just use homemade stuff and top of the counter treatments like a simple face wash, things like that. And then when I decided to get treatment for it, I saw a dermatologist when I was 20, and that was at the
Why?
hospital.
Mm.
Be for me, I just always knew that it was best to just go to a professional instead of trying to troubleshoot it myself. So I wanted to see a dermatologist and I did, and it worked for a bit, but like I mentioned earlier, I came back after some months and that discouraged me. So I didn't go back. I didn't reach out to the dermatologist anymore or try to say it was bad. And it just went on for a while. Um, and I kept trying to, at this point, I kept trying to treat it myself. I'm one of those people like Dr. Akinkugbe mentioned that just Google stuff. So I was Googling a lot of things and I wasn't doing any of those turmeric things or all of those interesting things. I was actually using skincare items, but for me, I have, or will I say had now because it's better now. I had severe acne and it needed more than just top of counter treatment. I needed to actually speak to somebody that knew better about it and could help me. And I met Dr. Akinkugbe in 2023, I think.
How
And
old were you
although I
then?
met her for a different skin condition, I
How
was
old were you then?
I was 27. No, 26.
Okay.
Well, I wasn't 27 yet. Yeah, I'm 28 now. And yeah, that was 2 years ago.
Okay.
So yeah, I was 26 then. Yes. And I met Dr. Akinkugbe there and then my professional I guess my second phase of my professional journey of treating it started at that point. And it took it took a while. It took a while because like I mentioned, I have severe acne and it doesn't just go away with simple treatments. It took a while.
And how are you now?
I'm very well now. Yeah, I'm very. I mean, I don't know what word to use when I say remission, but it's 5 months. I think it's 5 months since my treatment ended, and I'm fine. I barely have acne,
Mm,
just a
thank
few
God for
spots here
that.
and there, and they
But
go by
how did it
themselves.
make you feel when you had it? Did you have any of the
Oh,
issues? Did you feel stigmatized?
yes, very. I felt very horrible. I think that that's the word. So beyond the physical pain of having acne, because it's actually is painful. Your skin is hurting, even sleeping. So let's say you have a lot of acne on one side of your face, and you put your that side of your face down to sleep, it will really hurt. So there was the physical pain, and there was like the emotional and external pain of having to explain myself to people because people were just always assuming that people. I think there's a thing where people assume that you have acne because you're dirty or
Oh,
because of really ridiculous reasons, basically. And everybody always has something to say. Oh, have you tried this? Have you used this? And there are a lot of times where it just felt like I was always having to build myself up in my head to leave my house because there was never a time I'll leave my house and no, and somebody would not point it out. So there was always that, and it made me feel very ugly and horrible. So
mm.
it took a mental toll on me.
Oh, I'm sorry to hear that, but you feel a lot more
Thank you.
much better now. How about your confidence now and your
Yes, I do.
self-esteem?
Yes, it's a lot better as well. I was recently having a conversation with my friend where I was saying that that weight has been lifted. Like I just realized that I don't have to build myself up in my head anymore to leave my house. And I know nobody's going to say anything as well. So it has taken a lot of anxiety off me getting properly treated.
Fantastic. Thank you so much. Dr. Akinkugbe, if I can just ask you, I mean, so many things came up there. The first is, the lack of understanding of initially of the fact that acne doesn't just go away like that, and that she left the first dermatologist instead of perhaps going back, and it took her a far longer time. What do you have to say to people who are out there who may have been discouraged by maybe the first round not working as well as it should?
So, like I say, like Ife's example, she should have gone back, but there are reasons, it's how you feel. So you're not alone. You still need to come back, you know, go back to the same person, or you can find someone else, because truth of the matter is there are several stages. Each person's journey is different. And, we don't I individualize the care. You have to also listen with empathy. You have to help them with through the self-confidence. Say, I know how you feel. You know what I mean? Don't just give the treatment. The prescription is one thing, but connecting. I mean, Ife and I connected quite a bit. I did have to encourage her. She had lots of flares, of which during the flares she'd tell me how she's feeling, and I had to encourage her, and I then had to encourage her. And so when we're talking about treatment, we have to use oral treatment, systemic treatment, and we actually had to go the step further to using isotretinoin, which is
Mm.
something that it's the purview of the dermatologist. I have patients who've come to me and they bought it and used it at the farm,
Oh,
bought
wow.
it from the pharmacist
Oh,
and
that's
come.
dangerous.
And that journey, and if I will tell you, using those drugs are not easy as well. There's a lot of drying, there's a lot of scaling on the face, So you have to prep your patient. Your patient has to be well aware, and she was. You have to walk that journey with them. And so it's no two individuals are the same. No two severe acne situations are the same. When we talk about the scarring as well, you have, scarring that is quite mild. Then you have those that are really bad. When you have you, I don't know how to describe it, but you have ice pick scars, you have rolling scars, the ones that are, very, very obvious. And that in itself, needs treatment, needs you to cancel them, expectations as well. So they always want, if you don't give them their expectations, then, you and them are not in sync. And that's what matters. So it's just more than prescribing. It's also listening to them, offering mental support, talking to them and letting them know what the expectations are. That helps a lot.
Managing expectations is key, is what you're saying. And
Yes.
once people understand the journey, then it makes it much easier for them to follow. Now, there's so many questions. The first question that came up was, are pimples and acne the same? The second question is, what about this issue of, that we see all over the press or all over the social media about putting on mask of turmeric? Is it mask on the face of turmeric? Is it eating the turmeric? And what, can you give us, I mean, it's obviously World Skin Health Day. Is there a way that some of these things can be managed by what we eat or what we do? Please
Okay, so
advise.
pimples is the layperson's term for acne. So they're the same. All right. So I think that helps. Then in terms of turmeric, ginger, garlic, a lot of these natural things have antioxidant properties and anti-inflammatory properties. So to a certain degree, there'll be some improvement, just like it is for many other things, like with a common cold and some other conditions. However, plastering them on your face, everybody's skin is different. People can react to it. You go out into the sun, you have a phototoxic reaction. So I say use with caution because you can't plaster these things over your face. Many of the things that we use, the topical treatments, and they're very simple ones. You have gentle things, you have topical antibiotics that you can use, topical cleansers, which have some salicylic, which help to treat the inflammation, which also help with exfoliation. So there are several things that we use as part of the topical treatment. Now, some of these natural ingredients do have healing properties, but it's an all or none no. They're not evidence-based. So it's hard. And if you're at home just putting turmeric on your face to work today, might not work for the other person. So the key thing is use things mildly. When it's not getting better, the most important thing is seek help. Apart from topical agents that we have, we also encourage washes, cleansers that you can use. And then we move on to the systemic treatment where you're taking tablets to help your acne. Those tablets are used, in fact, they're abused.
Oh,
People
wow.
start taking them. They might have seen a doctor before who put them on doxycycline. That's one of the many things that you can use. So when the acne comes back again, they just start it. So they're starting it, they're not taking it properly, they're not doing the right thing. It gets worse. So those are some of the things, the problems
That's
that we
very
face.
important. Now, unfortunately, you won't believe this. Our time is up.
Time is
And I
up.
want you to I just want to say a very big thank you to Ife for coming to share her journey with us and share her experience with us. If you can give us some last words for our listeners who are out there listening with rapt attention.
Thank you very much. So sunscreen. We didn't get round to sunscreen. Sunscreen is necessary to use because of the environment that we're in. It protects you. It protects you from even photo damage and photo aging as well. And then the post-inflammatory hyperpigmentation, which is the dark spots that you have. This is all part of acne treatment. So what I would say, my last closing words would be, if you've tried something for a certain amount of period, 4 to 6 weeks, you're not feeling good, seek the help of a dermatologist. We have dermatologists all over Lagos, in the private hospitals, in the public hospitals, at Lagos University Teaching Hospital, at LUTH, at the general hospitals, Randall, Bagada, there's one more, just Lagos, General Hospital, Lagos. So they are there, and we're at the Nigerian Dermatology Society, and you can check us on our social media handles.
Thank you very much for this
Thank you.
wonderful discussion. We appreciate you both.
Thank you for watching. Please like, share and subscribe for new video updates.